And it was in the early 90s that a journalist came to see me and actually wanted to have some lip injections. And so and in those days, there was just the Paris pout. So I did the injections and she was so impressed she had another journalist come in, and so I ended up in the Telegraph in London Fashion Week as London Lip Queen.
Welcome back to the Late Late Aesthetics Show, the podcast where glam meets guidance and your beauty questions get the expert answers they deserve. I'm your host, Vanessa Brown, and today we're joined by an industry legend who needs no introduction, but I'm going to give her one anyway. Dr. Rita Rakus, welcome to the Late Late Aesthetics Show.
Thank you so much, Vanessa. It's such an honour to be here.
Thank you. You are also known as the London Lip Queen. You've treated royalties, celebrities, and thousands of men and women looking for natural yet stunning results. From her clinic in Knightsbridge, she spent over 30 years at the top of her field, pioneering non-surgical facial rejuvenation. You've been speaking globally, and you've also been raising the bar of what's possible in aesthetics. So in today's episode, we're going to talk tweakments, timeless beauty, and what it really means to stay relevant in a rapidly changing industry. So let's get started.
Okay.
So Dr. Rakus, you have been referred to as the London Lip Queen for years now. How did that title come about, and what does that mean to you today?
Well, it was very interesting. I started in this industry. I was working with a famous plastic surgeon who had the clinic where I am now for 30 years, and we were just doing surgery. And it was in the early 90s that a journalist came to see me and actually wanted to have some lip injections. And so and in those days, there was just the Paris pout. So I did the injections and she was so impressed she had another journalist come in, and so I ended up in the Telegraph in London Fashion Week as London Lip Queen. And from being a normal person, I changed overnight to the London Lip Queen. But I think the difference was that I'm very subtle, artistic, and also because of my background in having been trained in plastic surgery with the surgeon he trained at Harvard, I very much adapt the lip and the perioral area to the face. And I also analyse my patient before I even start treating, how the lips move when they're talking, what sort of industry they're in, what type of lip do they like, and also communicate with my patients. So that has been very interesting. Also over the years, it has changed a lot because I've been from the London Lip Queen in Tatler to the Machine Queen and Combination Queen. So there are a lot of now the newer technology with ultrasound and radio frequency. You can do a lot to the lip and laser to enhance without injection. Especially to our younger patients or patients who are older that want to have a natural lip. Yeah. So it's very important. And also we often combine now. We've got the new fantastic polynucleotides for these little barcodes. We may do a little bit of laser, radio frequency and ultrasound and a few little shots. So it's really advanced over the years on how I can treat the lip.
It's changed. The technique that you use, the protocol that you use definitely has developed over the years. And I'm sure you've done all your different techniques on various different patients over the years, from royalty to A-listers. You have quite an iconic clientele globally, not just in the UK, globally. But without naming any names, is there any wild treatment requests that you've had over the years that sticks out and you're like, that was crazy?
I have had a few. I'll run three past you. Is, for example, one of my ladies who had a large chain of pubs and getting an award for selling the most beer in the UK and wanted to have some good lips. So we did a nice injection for her. A couple from the clergy, that the two guys came in to have their lips done, so that was good. I've had an Air Force One lady pilot. And also, little sad but still helpful, is I've had a lady who was undergoing terminal cancer treatment and said, can you please inject me before at towards the end, so I look good in the coffin. So that one's a bit sad, but still, I feel that you're helping everyone in different areas.
Absolutely, definitely. And I think as a female, you know, taking pride in your appearance, no matter what stage of life you're at, is very important, because how we look impacts obviously how we feel as well. So it's really, really important.
And one thing I'd like to add is that I feel I try to give very valuable advice to the young ones. They come in, you know, 18, 19, 20 with their mothers, and I try and say, listen, you know, for the next 40 or 50 years, do you really want to have your lips injected? And now we can do various laser treatments, hydrofacial, polynucleotides. There's lots of alternatives rather than starting on the lip injection. Yeah. And the mothers breathe a sigh of relief.
Thank you.
But I try and guide them, and I don't reject anyone, but I say, look, please consider it, and let's try something more natural.
Yeah.
And so then they often listen to that, because it's too young to start into serious lip treatments, you know, when you're at that age.
Absolutely. So your clinic's based in Knightsbridge, opposite Harrods, which is a very, very prestigious part of the world. How has that shaped your patient database, and has it made patients demand more from you?
Although we're opposite Harrods in a very prestigious area, I do have patients from all over the UK and the world. And I used to, in the past, go and treat in Scotland, Wales, all over the place. So I have a following from all over. And the thing is that they do come in. I have patients from every type of patients as well. For example, I've got a 60-year-old cleaner that saves up all year with coins in a plastic bag. It says, Dr. Rita, why do you think a 60-year-old cleaner would want to come and see you? But it's competitive. I have got to keep my job. So I do have royalty. I've got normal patients, and I've got patients from various other walks of life. But I think they look at me as having a lot of experience doing natural treatments and good expertise, and also listening. I think the most important thing we do is listen to what our patient wants. I don't say, this is the sort of lip you need, this is whatever. I listen to what they'd like. I look at their social environment, their work environment, their age, and then we try and come to a happy medium.
Yeah, well, I've seen you do a live consultation on stage, and you're very much listening and asking the patient, look, what is it actually that concerns you? Because you may see something that isn't actually what the individual sitting in front of you is coming to you for. So you have to make sure that you are engaging with them, and not, because it can be intimidating. This is the whole thing. When you go for a consultation, it can be very intimidating if you've never had any aesthetic treatment before. So yeah, being honest and making them feel welcome is really important.
And also, for example, I can do the most beautiful lips I've ever done, and I've missed the one tiny crack in this corner that really irritates them. You know, so as you said, you have to listen. And I always say, now, what is bothering you the most? And then I try and give them an honest answer and how much we can improve it. And then I say, now, do you mind if we have a few suggestions backwards and forwards? And then often we're thinking of the same thing. But I have to be careful. I do treat the one thing that really irritates them, because I can miss it.
Yeah, exactly. So let's talk about the evolution of this industry. Obviously, not many people have been in the industry for over 30 years, like yourself. So you have seen things drastically change over the years. What would you say has changed the most in terms of how patients view beauty?
I think there's various facets to this. One is some patients have got a little bit more demanding, and especially with Instagram and social media and all that sort of thing. The other thing is that because there's newer technology, patients are aware of the fact that we could do more with machines now. Because when I started, it was basically plastic surgery and one or two. I mean, in those days it was Casey. And then the machines now, they're like mobile phones. The power of the machines have gone up astronomically, and so they can do a lot of treatments. But the patients find that a lot of my patients want a more subtle result. And we don't obviously select our patients, but our patients select us.
Yes.
And they know that we're doing a subtle result. We do combination treatments. We're very careful. We're also very safe, because even though it doesn't sound like much, have a quick shot in the lip, it can be quite dangerous. You can get necrosis, you can get this and that. So I think they come to us for safety and natural result, and also that they feel better. See, it's not only that you improve the look of the lip, but you've got to make the patient feel better. And a lot of my patients say, we love coming to you because the main thing is you make us feel better.
Yeah.
So I think that's very important, and improve their confidence.
Yeah, definitely. And then they'll keep coming back as well, because you can never replicate how somebody feels. That's more important for them. Have you seen any trends over the years that have come and gone, and any specific trend that you're kind of glad to see the back of?
Well, I think obviously in the lip area there has been the bigger lip trend, and we're very glad to, but I was never really so much involved in that because patients knew that we would into the big lips, but we've had a lot of patients when I have a number of doctors there, and also professor of aesthetic medicine, and we dissolve and we deal with correction. So a lot of our patients have had bad treatment somewhere else, or it's too big, or they've got lumps, or some of our poor patients had treatments 15, 20 years ago, and they've got product in there that you can't dissolve. So we try and help them, but the trend is to have a more natural look and a safer look.
Yeah, exactly. Do you remember there was a trend recently, the Russian lip look?
Yes.
And I think that's just a way of injecting, right? Or is it injecting a lot of filler in a certain way? Or is it a technique?
And also it's a little bit of Botox that only lasts a few months.
Yeah.
So I think it's a catchy phrase, and patients are always looking for something new and a little bit more glamorous. But whether it actually suits you, are you a person that a Russian lip is going to suit, and how long is it going to last? So it's quite important when my patients come in and they say, I want a Russian lip, or I want such and such a machine, or such and such a treatment. I sort of take a step back and I said, now let's look at first exactly what you're wanting. Because rather than I want a Russian lip, then they may want a different type of lip, which is not the Russian lip. Or they may want to have a treatment on the face which is not one of the machines that they've mentioned. So I think I try and go back and then analyse what they're actually wanting to look like, and how long will it last, will it suit them, also what will it cost. And we sort of explore that very subtly. But, we sort of say, now you have a few options. We've got about 3 or 4 options here, and you don't have to choose them all. We can try out a bit, so whatever. So it's really looking back, because often they come in with an idea, but it's not actually what's going to suit them.
Yeah, exactly. Yeah. Giving them honest advice as well. If you could whisper one piece of advice to a 20-something-year-old who's considering, let's say, getting injectables, what would it be?
So before even the injectables, I'd say a piece of advice I give to everyone is sunblock, sunblock, sunblock. And even on the injectables, because a lot of your barcode lines and everything later on are due to sun damage. But the one piece of advice I say, let's look at your program for the next 50 years and see what you want to do. How much money do you want to spend? How do you want your face and lips to look? So let's look at this. But I also say to them, I don't mind, we can try it out. That often when a young one has a treatment, it doesn't make so much difference. They're not going to be asked out on 50 extra dates. So they realize, so sometimes I say, let's just try it out and you'll see it's not that important. And I give myself as an example that I'll have something, then I won't have it for 2 years. So it's not as if you're necessarily hooked on it. So we sort of explore all the avenues.
Definitely. So you have had the privilege of being able to travel globally. So not just in the UK, but you've been able to stay ahead of a lot of trends because you've been at global conferences, you've been attending global conferences for a long, long time. And you're not just a practitioner. You educate, you teach people, you share your experiences. But how do you stay inspired and ahead in such a fast-paced environment? Things develop all the time. So how do you stay ahead?
Well, luckily, because I've been in the industry for so many years, and I also co-founded with the late Patrick Bowler, the British Association of Cosmetic Doctors. And I have a lot of, over the years when I've travelled, I've had the privilege of meeting a lot of the top doctors around the world, and we're all friends. And also I've been involved in the industry, so I know all the market leaders and the various companies that have come out over the years. And for example, you've got technology coming out of different countries like Israel, Korea, various countries. So because I've been in the industry so long, it's like a little club. And then when something new comes out, you sort of sit back and you talk to your friends. You say, now let's see what happens. It used to be that we'd sit back for a year or so, but it's so fast now. You've got to get going with it about 3 to 6 months. But first of all, we look at the safety, we look at the FDA and all that sort of thing. And also what our patients like, because sometimes there have been different trends and treatments come out, but they're not popular.
Yeah.
You know, so it's what our patients want. So it's a combination.
Exactly. But yeah, exactly. You've got to ask your patients as well. Is there anything that maybe we don't have in clinic that you maybe think that we should bring in? So getting their feedback. And I think that's important because they feel part of the family. They feel part, you know, they're part of something.
That's right.
And it's not just, you know, injecting them or doing a facial and saying bye. You want to make them feel welcome when they come into the
One
practice.
of my serious VIPs, and this is not an unusual example, she said, Dr. Rita, now, could I show you this video? I was in Hollywood. I was at this really famous clinic. I took a video for you, this new treatment.
Yeah.
Now, I think you should be doing this. So she showed me the video. So I've got spies all around the world telling me what we should be doing. And some of our most successful treatments have actually been initiated by our patients coming in and saying, listen, you know, and then I've also probably at the same time been thinking about it, but then it's been reconfirmed to my patients, so it's quite good.
No, that's fantastic. Is there anywhere specifically in the world, like a specific country, that you think is really doing aesthetics the right way, not just the UK?
Korea.
Yeah. Yeah, I mean, they are, you know what, I think it's because they are, they've been doing things for so many years that we then pick up on it. There's kind of like a delayed response as to what's happening over there, but they seem to be so advanced.
I know, and also generally Asia is sort of going through the roof, and I've been lucky enough, I was originally on the Buck Institute in Novato, California, but now I'm on the board of the University of Singapore for anti-aging and aesthetic medicine, so I'm able to really keep up to date what's going in that part of the world. So it's very, very interesting, but they really take it seriously. And also their women and men take their health and their aesthetics very seriously.
Were you not one of the first or the first to bring blue light therapy to the UK?
Yes.
When was that then?
It's quite a while ago now.
And what was the whole concept behind? Because light therapy, you know, is trending. Light therapy, people really are now starting to recognise the impact of what light can actually do, you know, on a cellular level. So what was the whole concept and how has that developed over the years?
So over the years, it has developed to, am I allowed to mention various brands? So the ultimate development now is the emerald laser and the emerald laser, and we've just got the new light therapy for brain fog.
Yeah, brain health as well.
Exactly.
Yeah.
So that's sort of the latest thing. But just to digress a little, before, in my other life, before I started in aesthetic medicine, we we had a pathology lab in Australia. We imported the first multi-channel analyzers and became the biggest lab in Australia. And then when we sold that, that's when I came over here and got involved in aesthetics. So I was always involved in the latest technology, and the blue light therapy was something, again, you know, newer technology, colleagues were looking at it. So I've always been interested, and this is how I've graduated from lip queen to machine queen, because I believe that we're the only clinic that's got all the machines.
You really do, yeah.
But we're very lucky in that we tend to choose the ones that do really well, because you could have a warehouse of machines. Yes. And when I go to conferences now, I almost get a migraine. I think, I'm so glad I'm not starting in the industry now. There's so much. But I suppose it's like anything else, you know, fashion, all sorts of industries. If you've been in it for a while, you do recognize the market leaders.
Yeah, definitely. So there's a difference between having loads of machines that are not very effective, but then having effective machines. And that's obviously what gives you the solid reputation that you have. So you have seen aesthetic medicine evolve drastically over the years. Where do you foresee it going in the next 5 to 10 years?
health.
Yes.
Aesthetic health. And sort of the classic thing that we've all been talking about for ages and patients are getting very aware of now, beauty from within. So you've got the gut biome, you've got your anti-aging, you've got all those areas. And that's luckily because I'm on the board of the University of Singapore, and the advances in exosomes, stem cells, all those areas. But it's really your health and longevity, but it's not, for example, there's one product out, there's quite a few, but say AKG, alpha ketoglutarate, you've got NAD, you've got all the ones, but this is a good example. It will extend your lifespan by about 10%, but the big thing it does is increases your health span by 24%.
Wow.
So say, for example, if I'm going to live from 80 to 90, but the last 10 years I'll be much healthier. That's the whole focus at the moment, is to have health span.
Yes.
Not to live longer. And the other big area is neurodegeneration. And you start at an early age of not having inflammation, looking after your brain and the inflammation in your body. And so, the new Emerald, we're very excited about having that, because it's like Russian roulette. You could be doing well, looking good, all that sort of thing, and bingo, your brain can go very quickly, and no one can really tell. But now, with working on decreasing inflammation and various other preventive measures. It's the same as skin cancer was in the old days, or heart disease. You can try and prevent the neurodegeneration and help yourself.
Yeah, exactly. And I think obviously you can get tests now as well to see like if you're genetically predispositioned to certain illnesses and diseases.
Exactly.
So if somebody, let's say, did one of those tests and it came back that they let's say have a specific gene that maybe would make them more prone to dementia or Alzheimer's, are there things that you could do to slow things down?
Of course, it's the same as having very sensitive skin. Or, I'm not saying, say, for example, breast cancer, and then you have a double mastectomy. I'm not advocating to have your brain taken out. But there are certain preventive measures that you can do. And from a simple point of view, say if you've got very sensitive fair skin and you've got skin cancer in the family, you're going to be a lot more careful than the average person. There's lots of things that you can do. And also there's the whole concept of epigenetics. So you've got a gene that will be expressing itself in a certain way. If you do all the right things, it will express itself better. If you do the wrong things, it will express itself worse. So say, for example, if you have got a normal height gene, if you do all the things, so a lot of protein, sunlight, going to bed early, you're going to grow a bit taller than you would if you do the opposite things. You won't grow. And I had a good example of that because all our my parents came out to Australia as refugees after the Second World War, and all the refugee children, because imagine in the Second World War the nutrition was very bad. So all the Second World War children, including our family, were all taller than our parents because we had sunlight, good food. So it's a good example of epigenetics, that whatever our height gene was, it would express itself better rather than worse. So that's quite important to look at how you,
definitely.
Even if you've got a tendency, you can make it better or worse.
Absolutely. So health is crucial. It's not just about looking a lot better on the outside. It's about feeling a lot better and things functioning like the younger version of yourself internally as well.
And inflammation is the thing. It causes everything.
Yeah, it's the root cause of all disease, isn't it? So keep that at bay. And it's not just one thing that you can do that will keep inflammation low. There's many different things. And I think, the more you do of something and the combination of things you do, the better chance you give yourself.
Exactly.
Yeah. So let's really get into your title of the London Lip Queen. So what really, in your opinion, makes a beautiful lip treatment? Is it product, technique, knowing anatomy, or is it all three combined?
Well, this is not a traditional answer, but one of my South American surgeons who came to visit me said, why do you think you're the London Lip Queen? And I said, I don't know if I'm that good, but I think there's a lot of bad treatments out there. I'm not criticizing other practitioners,
No, of course.
but you know what I'm saying, that you have to have an aesthetic eye. First of all, know what the patient wants, but start off subtly.
Yes.
Watch, as I mentioned before, the way the patient talks. You've got to look at their facial anatomy. And sometimes my patient, I laugh. They want a little bit in the lip and I end up injecting here and around here. So it's just to balance. There's no point in just having a perfect lip and all this is gone.
Yeah.
So because it's not going to look any good. So it's important that you sort of look at the whole picture and look at the person's milieu. What do they work in? What fashion do they like? Do they work like me, like wearing red lipstick all the time, or do they not want any lipstick? So it's very important to look at the total picture, and it's important not to be restricted to a certain technique, because lips have a mind of their own, and sometimes you'll do something and the lip doesn't react. You know, it could be a bit tight or a bit stubborn or whatever. So it's almost experimental. It's like a paintbrush. It's the same as I was trained by the inventors of Botox, the Carruthers, and they said, you know, it's like a paintbrush. So and they were teaching me, and although the classic way is the grid and the, you know, marks and everything, but, you know, they said, sit your patient up as like an artist. And in fact, a lot of my patients say, oh my God, you're like a real artist. So you've got to, and I like sculpture, I like art, all that sort of thing. So to train, the best training, I think, is to go to a lot of art galleries, look at a lot of magazines, you know, all that sort of thing, to get yourself into that mode.
Yes. Okay, that's a fantastic tip. Do you think that there's any mistake that people make when getting lip filler? Where to start?
You mean the patient?
The patient, yeah.
Yes. I think, well, first of all, a lot of my patients make the mistake, you know, I have the opposite problem. They say, I only want a tiny bit. I want a quarter of a syringe. And I try and tell them, look, if we do a quarter, you're going to come back to me in a week and say it's disappeared. So you have to be careful when so we put anesthetic cream instead of dental block because it doesn't swell your lip as much. And also when we have the cream on, when we put the injection on, you're going to be 25% swollen. So I always tell them it's going to drop back. So don't worry. So one of the mistakes in one of my category of patients is to have too little.
Yes.
The other one is to have the wrong expectations. You know, it's very hard, say, for example, to get rid of the barcode lines. So sometimes you have to have a combination of treatments. And now we're lucky. We've got soft lasers, we've got polynucleotides, we've got a little bit of filler. So sometimes you have to be patient and work on it. The other mistake is that they think, yes, they want a certain shape.
Yeah.
And you cannot, as I said, the lips have a mind of their own. Yeah. So I'll say, well, try and do that. But also we've got to pick a shape that is going to suit your mouth more, and that's possible to do, because sometimes when it's curled under here quite a lot, it's virtually impossible to get that curl up. Whereas then we discuss, I'll say, look, if we put a bit more here when we fix this, this is going to have an optical illusion of looking better, but we may not necessarily be able to do exactly what you want, but we'll try to make it look like it.
Yeah. So, yeah, because you've probably seen where people come in and they'll give you a picture of like a celebrity, for example, and say, look, I would like to look like that, exactly like that. But like if, for example, someone says, they want lips like Angelina Jolie, for example, their face may not be able to handle that, or it may not suit their structure as well.
Exactly. And also they may not be able to, you know, like they might need 6 syringes.
Yeah, I know, exactly. Yes.
So I know the lip, and one of my most touching experiences is when they bring in pictures of themselves when they're much younger, and some of my dear patients, you know, they you know, look at me 40 years ago and I say, no, we're going to try our best.
Yes, of course.
But, you know, and I've had, there I've seen, you know, what happens is if you have got a bad lifestyle, too much sun, smoking, or all the wrong things, you can really deteriorate. And some of my patients are 40 years older. They look quite good, but some that were sort of to die for in their 20s, 40 years later, but they've done all the wrong things.
Exactly. Is it true that, for example, drinking like through a straw, for example, that can give you those lines like above the lip? Obviously it's not just that itself, but is it true that that can lead to it? Because I read something where if you drink through a straw repeatedly, you're repeatedly using those muscles in that area. So if you're repeatedly using the muscles, then over time that's going to lead to fine lines developing.
I would say I could agree with that. You've got to be a lot of straw drinking.
Yeah, this is it.
I think the other thing combined with that is not to have sun damage. Replace your collagen, and this whole new concept of collagen banking. So the thing is that I know myself, you sort of look in the mirror and then a few weeks later you think I look like I've fallen off a cliff, because your collagen starts decreasing from your 20s, but around the menopause time it takes a big crash. So it's important to look after yourself. So some people could be drinking through a straw all their life and not a lot happens, but others that have done all the wrong things. And for example, even down to smoking, there's a contributing factor of that, because smoking decreases the circulation in your skin. So if you don't have good circulation as well, then your collagen's not in the same shape and all that. So it's a multifactorial. So there's certain activities that could make you worse, but it's usually combined with other factors.
Yes, exactly. And is it true that I've seen, for example, girls in their 20s and they've overfilled their lips from like 18, 19 years old? Is it true that that can actually stretch the skin around the lips? And if it does stretch the skin, how do you correct that? Do you always then have to have filler in the area?
Well, about 300 treatments of soft wave will try.
Yeah, exactly.
So it depends so much. I mean, obviously, and we don't see so many of those patients because they are, extreme examples. But, if you've really blown up, they sort of have, 3, 4, 5 syringes. It can stretch. Usually, most of our patients, it doesn't stretch so much. But also, again, it's a combination. If you've had too much filler, but you've had sun damage and you've smoked and you've drunk and you've had inflammation, and also everyone's skin's different. I have to be very careful. A lot of people that I inject their lips, they're very sensitive and very thin skin here. So sometimes you can have little lumps hanging down. So I'm always checking, open your mouth, smile, all that sort of thing, because they can have very, very thin skin. So you have to be careful.
Yeah, and is it true that lip filler can migrate as well? It can move to a different area?
It can. It depends on the depths of where you've injected. It's more unusual than you think, but it can.
Okay, yeah. Maybe is that maybe partly injection technique where it's been injected as well?
The combination.
Yeah. So how do you help patients unlearn unrealistic expectations? So we mentioned the Angelina Jolie look. She's beautiful, of course she is, but that might not suit the patient that's asking for it. So how do you manage those expectations?
Well, what I try and talk them into is have small treatments. I'll say, let's start off with it just depends how much they need, because sometimes they say I only want half a syringe, but they really need 2. But I'll say, let's try off with 3/4 of a syringe. I try and stage them, so that way they won't have, we'll improve them slowly, and then I can show them what is possible. Whereas if we dive in and do too much and then it doesn't work, they're going to be very disappointed.
Exactly.
And also we combine different treatments, as I say, polynucleotides, lasers, all sorts of things now that will help, and try and educate them and then show them, because sometimes we might just do a small injection and say, that's great, I didn't realize that would look so good. And also what their colleagues tell them and their friends, everyone told me I looked fabulous. So then they don't really want what they thought they wanted, because they're getting a lot of positive feedback.
So it's always easier to add than, let's say, to take away.
Yes.
Yeah. Okay, fantastic. So you've touched upon the fact that you are big about combination treatments, and your clinic isn't just one device, it's not just one injectable, it's really a combination of everything. Is there any specific non-injectable treatment that you swear by for skin rejuvenation?
Am I allowed to mention?
Yes.
Well, at the moment it's soft wave.
Yes. The results are fantastic from Softwave.
I know.
Who is the ideal candidate for Softwave then?
Almost everybody. So it depends on, obviously, giving a patient their expectation, because Softwave can be done on the face, the body, all over. It can be done, again, in combination with polynucleotides. Say, for example, if I'm doing a Softwave on the face, then we'll do some polynucleotides, and I was trained, as I said, by the inventors of Botox, but also by Dr. Levy, who invented the Nefertiti lift. So we'll put a few shots of Botox here, because that will soften this muscle. And then when the Softwave's pulling up, you'll get a better lift and a sharper jaw. Also, with polynucleotides, it's a clear fluid. It bathes your normal cells. It gets them to create a younger collagen. So the Softwave will trigger 40% more collagen reduction. But if you don't have the polynucleotides, it will get you to make more of your own collagen.
Okay.
Whereas if you have the polys, you're making 40% more of younger collagen.
Yeah. Okay.
So that is a very exciting combination.
And do you do them on the same day? What would you do first? The
I do the Softwave
first, and then
a bit of Botox and polynucleotides.
I think the Kardashians have made the Softwave quite popular, as they do pretty much anything. However, there are a lot of people asking, does Softwave hurt?
Well, it depends on how you do it. We put anesthetic cream on. We also, because I've been in the industry for so long and doing painful lip injections, we've got all the tips. Don't have too much alcohol the night before. Don't come at the wrong time of the month. Make sure that you've eaten properly. So we've got all the, in a way, holistic anti-pain measures. And then we put anesthetic cream on. And then it's also the technique on how you do it. Okay. And there's newer protocols now that are more advanced. So it shouldn't hurt very much if done in a certain way.
Yeah. I don't want to disclose your age, Rita, whatsoever, but is there anything in your personal skincare routine that makes you have flawless skin? Your skin is always amazing. Every time I see you, your skin is fantastic. You have very few fine lines. You've obviously looked after yourself. You have everything to your disposal about what you can use. But is there any holy grail product or supplement that you swear by?
I think, again, sunblock, because when I grew up in Australia, it was terrible, in the 60s. We just didn't use anything. So when I came over here, I totally had to, and in those days, there are newer, Fraxel still got, but there's a lot more other lasers. But I just had to totally laser myself and hands. And then now, because I'm older, I actually get a bit tired when I go in the sun, so I don't have to try so hard, but I just avoid the sun. Okay. And then very, very good food, and the whole gut biome situation keeps your skin in really good shape. And since I've been trying to eat more healthily, all my patients are saying, and staying out of the sun, saying, you're just glowing. So, and also things like Softwave that will give you a glow, and various other treatments. But I am very lazy with product. But there's just a few things that, and also if you have your skin analyzed now with the new artificial intelligence, different techniques, you can see what your skin really needs, because everyone's different. And also I'm a great fan of the blue zone, so all that sort of diet is very good for you.
Oh, fantastic. Are there any beauty myths that you wish you could just cancel for good?
I think that you want to, I think it's a hard one, but I think to want to look perfect and beautiful, with the new Instagram trend, we try and make our patients more attractive and feel more confident and bring out their your real you, rather than thinking, I want, they get the photograph out and say, I've got to look like this to be beautiful. You don't. And in fact, I was watching a program from a big Parisian beauty person, and she said that the thing that makes you more attractive is having a few imperfections. And everyone's a little bit lopsided, one thing and another, so not making you too perfect. And in fact, you'll see that famous actresses or actors have imperfections, whereas often the models that are perfect can't be famous in the acting field. So a little bit of imperfection is actually good for you and makes you more attractive, rather than having that sort of, I don't mean to say Barbie doll look, because I love Barbie.
Me too.
But I think that is the beauty myth, that you've got to look perfect, you've got to look like a certain person, because so many of my patients are in their 60s, remarried, really happy, and they're ordinary, and they've just looked after themselves, and they're not, whereas I get a lot of patients in a bit younger, you've got to take a breath. They're so beautiful, and then they come in crying, I don't have a boyfriend, or my husband's just left me. So I think the beauty myth is to be yourself and let your inner self come out, rather than trying to conform what you see on social media.
Yeah, you're right. And I do think it's more, there's more pressure, I think, for people, late teens, 20s, 30s now. I think there's a lot more pressure because of social media. And I think that's definitely changed the beauty standards, globally, really.
And sorry, I'll just add, because if you look at some of the famous actresses that are really beautiful, but they, you would say she needs a nose job, or, she needs this or that, but it actually, that little imperfection or difference makes them look more attractive.
Exactly.
So you mustn't, and that's what we pride ourselves in natural treatments, and not sort of one treatment fits all, to look at the patient, think, how are we going to bring their personality out and make them more attractive, rather than let's get rid of this and that. And
Yeah, exactly. Enhancing your own inner beauty.
Yes.
Yeah. Right, let's finish with a quick fire round. So just say the first thing that comes to mind. Filler or radio frequency?
Radio frequency.
Botox at 25, smart or unnecessary?
I'm not sure.
Depends. Your favourite treatment to perform?
Soft wave.
Biggest red flag in a new client consultation?
Not listening to them.
Okay. If you could give women one piece of beauty wisdom to hold on to forever, what would it be?
And I've said this many times in this podcast, is sunblock.
Yes, fantastic. Thank you so much. It's been an absolute pleasure to have you on the show. Your expertise, your wisdom, and you have just an incredible track record behind you. And I know that our audience has listened and learned so much from your insights. So to everyone listening, if you're in Knightsbridge, please visit Dr. Rita Rakus. She has a beautiful clinic, which is undergoing a refurb at the moment, opposite Harrods. And don't forget to follow, like, and subscribe. Thank you so much.
And thank you.
Thank you.